Hi, I'm Kerry Hall, America's Healthcare Advocate. On our show today, we're going to talk about the mega tsunami that's coming. That's right, the mega tsunami that's coming with all of the ACA Obamacare plans. We're going to talk about an alternative. If you're a 1099 employee, if you're self-employed out there, if you're a realtor, if you're a contract ER doc, if you're an Uber driver, whatever the case may be, we've got something that is worth taking a look at. It's called GigCare. Stay tuned. You're going to learn a lot on this show today.
And now, America's healthcare advocate, Kerry Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. My producer's in studio today, Mr. Dave Thiessen, the man behind the cameras that posts all these shows up on our podcast and YouTube platform. By the way, 604,000 of you have viewed our YouTube and podcast. We're pretty happy about that. I want to thank you, all of you out there in the audience that pay attention to this show and go up to our YouTube platform and our 16 podcast platforms. By the way, our website is americashealthcareadvocate.com. If you have a question or comment, please feel free to send me an email. I get a lot of them, but I answer each and every one of them. So if I can help you, I am more than happy to do that. If you are chronologically challenged and you're looking for Medicare coverage, or you're struggling with this Obamacare issue that's coming on board right now, you can always reach out to the lovely Carol Lee Steele over at RPS Benefits by Design. Wherever you are in the country, they're happy to help you with Medicare or with ACA. Additionally, if you are an employer looking for an opportunity that might be something different, you probably ought to call Maria Allers over at RPS Benefits by Design, 877-385-2224, anywhere in the country, 877-385-2224. In studio with me today, John Stockton and Tracy Krause from Detego. We are going to be doing a show today on GigCare. So this show today, and I've wanted to do this for some time, we're going to talk about why GigCare was created. Detego is the parent company that created GigCare. Why do we create it? What does the product do? And it's a health benefits plan. And who is this product really for? So that's what we're going to talk about today. And here's the thing you want to keep in mind. There's a huge tsunami coming in ACA right now with all the increases and the reductions in subsidies and all the rest of it. It's going to impact people across the country in a lot of different ways. In addition to that, okay, if you're a 1099 employee out there, if you're an Uber driver, if you're a contract ER doc, if you're a contract ER nurse, if you're a contract anesthesiologist, if you're a realtor, if you're a truck driver, and you're 1099, this might be a health benefit plan you want to take a look at. But we're going to start off by just talking about what's going on in the marketplace today and the disruption that we expect to see. So, John, let's talk about that a little bit. You've got a table there that's talking about some of the increases we're going to see across the country. Let's talk about that and the disruption that we're going to see. You and I kind of nicknamed it the ACA tsunami, so let's talk about that.
I think the only place I would disagree, Kerry, I went into ChatGPT and I said, what's bigger than a tsunami? And the answer is a mega tsunami.
Okay, I didn't even know that existed, okay, so I'm impressed.
The average increase for the ACA across the country is 23.43% projected at this point. There are a handful of states that I circled that just are eye-popping. Texas is at 31, Tennessee's at 35, North Carolina's at 28. New Mexico's at 36. You see these, Arkansas is at 36. Delaware's at 38. You just see the impact of the ACA. You see a large carrier pull out of the ACA. So and that impact is just the base rate increases, not even considering what's going on with the subsidies.
Yeah, so when you put all of that together, if you're not on an employer-sponsored health plan and you're out there on your own trying to figure this out, it becomes much more challenging and much more difficult, does it not?
Oh, it absolutely does. You are stuck and you are relying upon the ACA to take care of your needs. And we know that with this magnitude of increase, the people that will lead the ACA are those that can lead the ACA. So in our opinion, the ACA is looking at a death spiral, and it's only going to get worse.
And the reason we say that is because the only people that are going to stay on there are the people that have to stay on because they're too sick to get off. And we're already seeing that in the marketplace with a lot of people. I would say if you look at people below the age of 30, 35, even below the age of 35, and you ask them, it was funny, we were on a Zoom meeting here about a month or so ago, and there were a number of very young people on there who were IT people, and we asked how many of them had health insurance. They laughed. They said, Tracy, no, we don't need health insurance. I'm like, okay, you don't need health insurance. And that's the attitude. And the other part of the attitude is that Obamacare ACA is too damned expensive, and they just don't feel like it's worth what they're going to be forced to pay for it.
The underlying cost of healthcare is a whole separate conversation you and I have had before, Carrie, but the financing model for the ACA is not working either.
No, and we only think it's going to get worse. So let's talk a little bit about, let's just talk about why this product, Detego is the parent company here. Population Science Management is the company that actually offers the GigCare product. We can talk about that a little later. But the GigCare product was actually designed to go into the 1099 marketplace, people that are 1099 folks out there that don't have group health insurance plan. Now, how many of them are there? 80 million now, John?
80 million. By the start of 2027, the gig economy will represent 100 million Americans, which is astounding.
So we think that this is an opportunity for people in those areas, people that are realtors, people that are those Uber drivers, people that are contract drivers for FedEx, or those Amazon drivers that are contract Amazon drivers, or the truck drivers.
Or such a broad, it's hospitality, it's the beauty space, it's the tattoo artists, the musicians.
Think about the tattoo artist, John. That was one.
It's a very broad, so when you start talking about 80 million today, it's again, very broad.
And those are the folks that don't have access to employer-sponsored health care. So they're looking for an alternative. And the GigCare product was created specifically for that marketplace to give them an opportunity to find health benefits that were better than what's on ACA, that were less expensive than what's on ACA, and actually offer a wider range of coverage in some ways than what we see on ACA.
I would just also add, Carrie, it might be for W-2s that are part-time and not eligible. So GigCare is a great fit for those who aren't eligible. So we've talked to a lot of large employers who have a number of part-time employees where this is a consideration.
Well, that brings to mind some of the other employers that we've talked to. Okay, you know, we have a trucking company out of Lincoln, Nebraska. It has 4,000 truck drivers. Well, it turns out 400 of them are 1099 people, and they didn't have any health benefits to offer them. We're seeing this in co-ops, agricultural co-ops across the country, right, John?
Absolutely. A lot of large farmers co-ops, a lot of association opportunities that it's created for us.
Where they don't have access to the kind of health care we're talking about unless they go on the ACA, Obamacare, which unfortunately a lot of them just don't want to do, or have had a bad experience with, or it's cost prohibitive now.
It is cost prohibitive, and depending on what happens with the subsidies, it could get even worse. It's still the average increase going up 23.4% is with the subsidy staying the same. So it could get significantly worse.
Yeah, and that's a state by state thing. So you're seeing this is another thing we'll talk about when we start talking about the plans here. But our plan pricing is universal across the country. It doesn't change on a state by state basis like ACA does, correct?
Correct. We have the same rates across all of our state where we offer our coverage, and they're just by age band.
So it is by age band. We offer it across the country. And when we come back to the break, what we're going to do is we're going to start talking about GigCare, how it works, who it serves, and how you gain access to it. If you want information on this, by the way, if you're a broker and you want to learn how to sell this product, how to take it out in your marketplace, we are happy to have you. It's very simple. Here's what you do. You go to gigcare.net, gigcare.net. There's information up there. Fill out a card, send it in to us, okay, on the web. It's easy to do, okay? Or you can call 866-886-2030. That's 866-886-2030. Be happy to chat with you. And if you're somebody looking for this kind of health benefit, we're more than happy to talk to you about what we're offering at GigCare, how it can serve you, and why it could very well be something that would be better for you from a cost standpoint and also a benefit standpoint than what's in the marketplace today or what's actually coming to the marketplace. So we'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. Once again, that website is gigcare.net. That phone number is 866-886-2030. Stay tuned. We'll be back with more. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. If you want to find out more about us, go up to the website, America's Healthcare Advocate. By the way, you hear this show, you want to tell somebody about it. Maybe you've got a company that's got 1099 employees along with W-2 employees, you go up on the podcast platform. It's on SoundCloud, Spotify, 16 platforms across the country, and our own YouTube channel, America's Healthcare Advocate. All you got to do is tell them to go listen to the show there. They'll understand exactly what we're talking about. Once again, it's americashealthcareadvocate.com. The YouTube channel is America's Healthcare Advocate. If you want information, maybe you want to find out more about this, 866-886-2030, 866-886-2030, or gigcare.net. All right, we're going to change up a little bit, Tracy. So let's talk a little about, I don't know who it was I was talking to not so long ago. We were talking about customer service. He said, the problem? The word service is gone out of customer service. And so, especially when it comes to health benefits, and when you're talking to people, they've got a claims issue, provider issue. How critical is that? And why? I asked you to come in today to talk about this because that's really your area of expertise and one of the things that you help us do and do so well. So let's talk a little bit about that. Tracy?
Well, great. Thanks, Carrie, for having me. I 100% agree with you. I've been in the customer service area for different consulting firms, for different carriers, now in this role with Detego, and it's really putting that service back into the customer service. There aren't many things as personal to somebody as their health care. And at that point in time, when they're at the doctor's office and they have that ID card, that's their insurance, that's their security, and they need to make sure it works. So at Detego Health, we have the customer service agents who are live. We're also leveraging artificial intelligence, right? We're doing some of those voice IVRs, hit a button, go here. But at the end of the day, it's being able to talk to a live person who can listen to you, understand, and then direct you through the right ways in order to get your questions answered, your problems resolved, your doctor's office answered. That's really what it's about. It's that first point resolution, and that sets the tone for that relationship between the member and the coverage that they've
and
purchased.
I think one of the things that separates us from the national carriers, if you will, when you call and there's 4 voice prompts you have to go through before you get to the 5th one. And if you're lucky, you might be able to actually talk to somebody, okay? Our program doesn't work that way. Customer service starts, what time does it start in the morning? 7 in the morning?
7 in the morning.
And it goes till 6 at night. Mm-hmm. So obviously we've expanded the hours so people have more of a chance to call if they have an issue. Mm-hmm. And the idea is, as you said, to have a live person there to talk to them so that they know they can get their problem resolved.
We've even gone to that outbound proactive reach. So once a member has had the conversation with their agent, they've selected the plan, and then things kind of go into that quiet period, right? We've started that proactive outreach where we're calling the members and saying, do you have any questions? Did you have anything maybe now that you've had the plan in place for a week or so? What kind of questions do you have? And we've really uncovered what those employees, what those members are trying to buy and how we can help them. It's about finding the right information. It's also about, in this day and age, right, we've got 5 generations in the workforce. You've now got those same 5 generations seeking healthcare, and they all have different needs. And so it's just providing them the information they need for their healthcare journey to be successful. That's really a lot about the customer service aspect.
What I always used to say, and I was a broker for 27 years, was it's not if you're going to call, it's when you're going to call. You will have an issue somewhere along the line. There will be a provider issue, or there'll be a claims issue, or something will happen. But the idea is that we've got somebody there to help you, and we're not just telling you, well, that's your problem, you need to get it solved.
100%.
Yeah, and that's the whole purpose behind customer service. Switch a little bit to now how we communicate with brokers, because we are 100% broker distribution. That's important for you to know. All right. So we rely on our brokers all over the country to take our product out in the marketplace, and we go to a lot of trouble to service our brokers and give them the information they need and the tools they need. So let's talk a little bit about that and how, if a broker has a problem, what we do to step in and help them.
So the level of service that we provide is equal to the education that we set it up in the beginning, right? Let's all be on the same page, right? Population Science Management, which is administered by Detego, is an opportunity for your clients to get access to a group health plan. Now, within Population Science Management, we have different segments. We have the GigCare, which is what we're talking about today, right? Major medical, comprehensive coverage with 3 different provider networks to choose from. Great. We also have MaxGuard, which is a limited benefit plan that also now has a network. We then also have reference-based pricing models, which might be what the agents and brokers' clients want. We are here to be that one stop with 3 different solutions that may or may not be the best fit for your client. But we are here and we do provide a solution.
One of the things we do is we really go through a lot of trouble to educate the brokers. Talk about that and what that, because you're not just going to walk in and get this product and take it back out on the street.
No.
So when you go to sell an ACA product or when you go to sell a Medicare product, you go through a whole training process. You go through a training process to sell GigCare, any of the population science management plans. You have to go through it. So talk about that.
This is a great opportunity. This is delivering a healthcare model in a different space, right? And again, we're not for everybody. Population science management isn't that ACA where you're going to drop those unhealthy people. People are unhealthy, right? It happens. Things happen. What this is it is that absolute health benefit option for you to choose from. And each one of our tiers within population science management serves a different purpose for the clientele that you're going after, right? That early retiree probably is going to want a GigCare plan, right? It's got 3 different national networks. It's got the comprehensive coverage. That rideshare driver, they're not going to want that comprehensive coverage.
Probably
We've
not.
got that MaxGuard suite of plans for them to consider. What we do up front, though, is have that education for those agents that want to take the time, right? This is GigCare. This is population science management. This isn't Medicare, and this isn't ACA, and this is unique to our space, and it's an absolute solution for your clients.
And so what that means is if you're the broker and you're listening to this and you're interested, there is a training process. You actually have to take a test, okay, and you have to go through this training process. And the reason for that is, as Tracy just said, this isn't for everybody. There are different plans that fit different needs, and that's what we're doing here. We're talking specifically today about GigCare, that plan which primarily services the 1099 market. But if you want information, you're interested in this, you've got an area out there that you cannot get those clients covered. You can't find policies they like. Narrow networks under ACA. Prices are too high. They don't want to do it. Now you've got a product that probably makes some sense, but you're going to have to go through the training and education process so that you can present it the way it needs to be presented. If you want information, go to the website gigcare.net. That's gigcare.net, or call 866-886-2030. 866-886-2030. Stay tuned. We'll be right back after the break. We're going to get into the plan designs now and what do they actually look like and what do they cover. We'll be right back after the break. Stay right there. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. My producer today, Mr. Dave Thiessen, behind all the cameras, Garna Cowdery, the man behind the microphones. Again, all these shows are posted on our podcast platforms. There are 16 of them, okay, as well as our YouTube platform. So you hear about this, you want to tell somebody about it, you want to share it with somebody, that's a great place to go. And instead of you trying to explain all of it, they can go up there and listen to the whole show and get all the information so they understand how it works. We're talking about the plan today, the health benefits plan called GigCare, offered by Population Science Management. 866-886-2030. If you want information, you want to call, learn more about it, that's what you can do. Or you can go to the website, gigcare.net. All our information is up there. All right, John, let's get in the weeds a little bit, okay, and talk about these plans. So the 3 separate plans Tracy just talked about, offering on separate networks. So first we have the Blue Cross and Blue Shield plan, which is offered in Nebraska, and that plan is called?
We call that plan Thrive.
Okay.
So we have an important partnership in the state of Nebraska with Blue Cross, and we are very excited about our opportunities in that great state, working with the local Blues there.
And we've got a lot of opportunities coming up in the state of Nebraska, and a lot more work we're doing in the state of Nebraska with some of those farm co-ops in the state of Nebraska.
Yep.
So let's switch gears because we now have Aetna national network to offer our clients.
So the Aetna plans are branded Livelihood. With the Aetna plans, they are EPO, which means in-network only. Obviously, anything out-of-network that's emergency is going to be covered as in-network. Deductibles range from $1,800 up to $8,300. We have HSA options. Probably the more popular question, Carrie, we get from brokers is, where is the intersection between where GigCare is more competitive than the ACA?
On a price point.
On a price point. So I wanted to talk about that real quick because we sell in 4 age bands that are the same rates across all of our states that we sell into.
But that separates us from ACA. Our rates don't vary based on the state. They're the same across the country.
Right. And so those age bands are 18 to 29, 30 to 44, 45 to 54, and 55 to 65. So this year, our sweet spot for GigCare has been really in the 40 to 45 plus. In the first segment, we talked about the rate increase on the ACA being in 23 and change. The impact of subsidies could literally have some members paying double what they're paying this year in 2026. So we feel like our sweet spot will be pushed down into the lower age bands. But again, then there's same rates across all the states we sell into. And we expect to be competitive, certainly in that 30 to 44, and possibly even into that 18 to 29, I suspect, depending on the state.
Yeah, because what's going to happen is as the subsidies reduce and the prices go up, our prices have pretty much stayed the same. I think our increase this year was 7%, if I'm not mistaken. So, I mean, when you compare that to what's going on in the marketplace, that's pretty significant. And by the way, that's the same increase that we had last year. So we're very proud of the fact that we've been able to keep it in the single digits and down to 7%. So again, let's talk about some of the plans. So you mentioned the HSAs and some of the high deductible plans. And this goes back to, what Tracy was saying earlier. What the 25-year-old Uber driver needs is not what the 55-year-olds, looking at retirement now in 5 years or 10 years, whatever it is. They don't have any children at home. They're empty nesters. An HSA at $6,500 probably makes a lot of sense for them.
Yeah, no, it does. And I think all of our call centers do a very good job with the needs analysis. So we can illustrate both the Aetna logo or Blue Cross if we're in Nebraska, and we can also show an EPO or PPO option. So we're trying to meet the members where we at. Where they're at. Tracy mentioned MaxGuard. So MaxGuard, literally, it's a limited benefit offering with a price point roughly half of GigCare. So we've had some conversations with some of our rideshare drivers, et cetera. It probably represents about 30% of what we're marketing today for MaxGuard. And then for somebody who wants a more comprehensive plan, we have our GigCare solutions.
Yeah, and so the idea here is that we've got something that fits whatever category you happen to be in. If you're a senior citizen or approaching senior citizen, or you're 25, 35 years old, maybe you've got 2 or 3 kids in the house, we've got different plans that offer better opportunities. Let's go back to EPO versus PPO, because this is going to confuse people. So EPO, if you're on Aetna, means you can go anywhere in the Aetna network, right?
Yeah, Aetna networks are broad networks. The EPOs simply means if there are out-of-network providers, they're not covered. You have to go in-network. So our guides will work with you guys along those just to make sure the members understand the network. PPOs cost more than EPOs, everything else being equal. But if you want an out-of-network solution, Blue Cross of Nebraska.
So the idea there is that if they're looking at the EPO, you've got access to the whole national network. But that's a huge network. Yeah. With some of the best hospitals in the country, MD Anderson, Sloan Kettering, go down the list, okay? Mayo, they're all in there. If you're traveling cross country, you have an accident or something happens, you need medical care, you're covered anyway. It's not that we're not covering you, but we're saying if you stay in the network, it's going to benefit you price-wise, okay? And it's an opportunity. You still got this huge network.
Carrie, I was with Aetna for 25 years.
Yes, you were.
We used to run disruption analysis on all these large prospects, and if it got to more than 1.5% or 2%, it caught my attention. So yeah, there's hardly any out-of-network utilization with these large networks from Aetna in particular.
Yeah, because they offer such broad networks. And here, I'm going to make a distinction here that's really kind of important. When you look at ACA, those are narrow networks. You know why? I'll tell you why. Because if you control access, you control cost. So what the carriers are trying to do because they are struggling to control cost under ACA because you've got government mandated healthcare here, okay? And when the government mandates something, it doesn't leave a lot of leeway for these carriers to make sense out of this or even be competitive. So they squeeze the networks down. Well, the problem is if you happen to live in Nebraska and you're in Grand Island or you're in Scott City, Kansas, you may not have a provider. You may be in a situation where you have to drive an hour, 45 minutes, whatever it is, to get to a primary care. And if you need a hospital, you're going to go to one of the metropolitan areas for a hospital because rural hospitals are typically not in these networks. When you contrast that with the Aetna National Network, where you've got coverage across the country, there's a significant difference here. So, when we talk about these plans versus the ACA plans, those are some of the things that we think separate us. That particular piece on networks and access, if you're in a rural community, this can be really, really important to you. And again, if you do want the PPO versus the EPO costs less money. It's a great way to save some money and still have a great plan and great access. There's coverage there for you, so that makes a difference. Let's switch gears just a little bit and talk about some of the differences. So, Tracy, let's talk a little bit about the telehealth program, because I think our telehealth program, this is really funny. I saw an analysis the other day where the carriers are now charging for telehealth anywhere from $25 to $65 for a telehealth visit. We don't charge for any of that.
Right, when you're using our telemedicine.
Correct. My Live Doc.
Correct. But that's all about preference too, right? You're going back to that age where they're used to what they're used to. It was on the back of their card. We've partnered to provide this free telehealth, right? It's free, but this is the avenue in which you get to seek that care.
So it's very, very different in that respect. Here,
it's very different.
And there's three things we offer here. So first of all, there's 24/7 urgent care, emergency care. So the analysis I always like to use is mom comes home to work at 5:30 at night. Johnny's got pink eye. She's got to put him in the car, drive him to urgent care, wait 45 minutes to an hour to see a provider, get a prescription, go get the prescription, drive back home. She's 2 hours out of her day. Now it's 7:30 at night. She's dead tired and she's had to do all of this. Or if they're on our plan, they can go to My Live Doc, pull up 24/7, a doctor, a nurse practitioner. Johnny sits down in front of the computer. Doctor goes, "You got conjunctivitis, young man. Here's the prescription, Mom." It took 15 minutes. So we think, especially in the rural communities where they have to go a long way back and forth, as you just said, Tracy, this can make a big difference. The other thing that we do here is, again, we go back to rural communities. If you find a primary care provider on there that you like, maybe you live in Scott City, Kansas, you don't want to drive, whatever the case may be, you can stay with that primary care doctor. And a third piece, and this is really kind of important, I just did a show on this with Ryan Lefevre, 27-year broadcast with the Kansas City Royals about mental health and behavioral health. There is a crisis in this country of mental health and behavioral health, especially in young people. You see all this, John. You've got two boys now that are growing out of the house, but I've got 6 grandchildren. Okay, they're not there yet, but they're getting there. I've got one 17-year-old, and there's a lot of concern about the pressure it's on them for with all of these issues on behavioral health. The beauty of this program, these are free. There's 4 free visits for everybody in the family. Your son, your daughter is having problems. They're having problems. You can bring up that behavioral health provider. They can sit in a room with the door closed on a computer, and they can go back and forth and talk to them. How important is that privacy?
Yeah, the generations all access care differently. I want to be face-to-face with the doc. My 28 and 24-year-old.
That's our generation.
They don't want to be face-to-face. My 2 boys want to be virtual. So we have to meet members where they're at. The other thing I want to mention, Tracy mentioned this earlier, the proactive outbound nature of what we do is extremely important because we're engaging the disengaged. The disengaged will cost 4 times the engaged. So our ability to proactively reach out to members is really important.
It goes back to that population science management, right?
Yeah.
We're going to the different generations, allowing them the ability to access care at different points
where they
it
are.
Intersects their life.
Right.
Yep.
Where they are and what they want. If you want information on GigCare, website is gigcare.net. GigCare.net. The phone number, 866-886-2030, 866-886-2030. Stay tuned. We'll be right back after the break with more. We're talking about, what are we talking about, John? The upcoming, what are we calling it?
Mega tsunami, Kerry.
The mega tsunami's coming.
Only fewer than 20 states have finalized their ACA rates. The average projected increase for the ACA, independent of what happens with the subsidies, is over 23%. A number of states are well into the 30s. For those losing subsidies, it could easily get into the 75 to 100% range. So some members losing subsidies will literally see their prices double within the ACA.
So we think that PSM, the Population Science Management offer of the GigCare product, is an alternative that people and brokers really need to take a look at.
A variety of solutions, Aetna, Blue Cross, EPOs, PPOs that are going to meet members' needs right where they are.
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. If you have a question or problem, please feel free to reach out to me. I'm happy to help you in any way that I can. The website's americashealthcareadvocate.com. If you are interested in the GigCare product, you want to know more about it, you think it might be a fit for you, or maybe it might be a fit for some people in your company. If you've got 1099 workers that you can't offer any coverage to, this is a great way to introduce them to GigCare. Great way to do it. The website is gigcare.net. The phone number is 866-886-2030, 866-886-2030. Somebody like the lovely Tracy Krause will be happy to help you and talk to you about the plans, different plans, sets of plans. You heard Tracy talk about that, from our limited med to our group benefit side to our individual side, which is GigCare. All right, John, let's talk a little bit about this super tsunami a little bit and kind of educate people as to what's coming. Mega tsunami, I'm sorry.
So we've had a number of conversations, and most recently a large farmers co-op used the term whiplash is coming, and here's why. So fewer than 20 states have finalized their 2026 ACA rates. We have this shutdown that's really due in large part to subsidies. So people haven't seen their state's final ACA rates most often. They don't know what's going to happen to the subsidies. So people generally are unaware of this tsunami, or this mega tsunami that's on the way. So the term that was used is there's going to be some whiplash when people open their ACA statement. So the thing I want to make brokers aware of is there's a lot of unknown and naivete, if I can use that word, around where things are going with the ACA. So the beautiful thing about our offering is they can enroll in GigCare in any month out of the year.
Yeah, so there's no open enrollment. There's no open enrollment. Okay?
So ACA important. Is all around January 1, right? So we are very busy enrolling people right now, but certainly with this whiplash that's going to kick into effect, people can jump off the ACA whenever they want, and we're a solution any month of the year. That's an important consideration that I wanted to point out.
Yeah, it is. And when the dust settles and we see where we're at with subsidies and all the rest of it, I think your comment about whiplash is spot on. Let's put it that way.
So brokers need to educate what's going on out there.
And again, you're a broker out there. This is something you really ought to take a look at. It's going to make a difference for you. It's going to make a difference for your client. And maybe there are clients out there you have not been able to get in the door to talk to them because you didn't have a product to offer. You do now. Okay, it's called GigCare. The website is gigcare.net. There are a couple things I want to touch on, though, that are a little different from what we do. We like to say that we offer some different benefits that are not the same as what are on the ACA plan. So we have a program called Green Imaging. And if you need an MRI or a CT scan, you can get a voucher from us, from Green Imaging, and you're going to go to an independent imaging center, and you're going to get that MRI and that CT scan done, and you're not going to pay anything for it. That's right. No deductible, no coinsurance, and no copay. That's part of what we do. We're different than ACA because we can do things that the ACA plans can't do. Some of the other things we do drug importation. So we have 3 different programs we can help people with on drug importation and foundational assistance if they have a very expensive med like a growth hormone that they can't afford. We have a foundational assistance program. You know who does all that paperwork? All of our nurses at Script 8. We don't put that back on the client. As Tracy says, we're there to serve the member, and that's what we do. So those are a couple of things that are very different about us. We talked a little bit about My Life Doc. We think that's a great program. Again, there is no copay when you use My Life Doc. Whether it's mental health, urgent care, or just primary care, there is no copay. And then we have another program for diabetes. And if you're diabetic, we're going to enroll you in Diet Thrive. That program is going to make sure you got your A1C. They're going to make sure if you're taking metformin, it's being drop shipped to your door, or you're getting it and you're taking your medication, so that we're managing the disease. You know, John, how important is it to manage chronic disease in terms of giving people what they need, but being able to keep costs under control because you're being proactive, not reactive?
Yeah, no, that's for us to help our clients and our members to be engaged, Carrie, doing the things they know they're supposed to be doing. We're the most obese country in the world. So coming alongside plan sponsors, employers, members to really help them engage in a path to a journey of wellness is extremely important. And what we do now is going to show when we get further down the path in our years.
Yeah, it is. And it's critically important that we do this in a way that serves people and gives them an opportunity for these plans that are going to make a difference for them, because they are
absolutely
different. We're serving a different piece in the marketplace, and we think that if you're one of those folks out there looking for this kind of coverage, and you, as John has said and as Tracy said, there is a mega tsunami coming. It's going to have a tremendous impact in this country on a lot of folks. Our plans we think are more affordable. You'll see that when you actually look at the plans, the different plan designs. They're more flexible. We have far more designs and opportunities than what are offered on ACA because we're regulated differently than ACA is. We're regulated by the Department of Labor under the ERISA laws. So we're compliant with all of that, but it makes it different for us in terms of the product we offer. So if you're the broker out there and you're looking for something to serve a marketplace, and I'll give you a couple of exampos. What do we have? 5 different initiatives with major real estate firms going on right now, from Reese Nichols to, go down the list. Better Homes and Gardens. So we've got a whole series and we've got associations of realtors, where they're the Missouri Association or the Kansas or the Iowa, whatever it is, okay, that are happy to have this product because these realtors, have been on ACA. And I'll give you an example, one before we close out the show here. A gentleman was 52 years old. He worked at Reese Nichols. He has a wife and 1 child. He's paying $3,100 a month. He moved to the GigCare plan on an HSA with a $5,500 deductible, and he dropped his cost to $1,400 a month. Better plan, better price, better opportunities. That's what GigCare offers. If you want information on it, go to the website gigcare.net. That's gigcare.net. The phone number, 866-886-2030, 866-886-2030. If you're a broker, you owe it to yourself to take a look at this. If you're an employer out there and you've got those 1099 employees and you have nothing to offer them, this is an opportunity. If you're an association looking for a way to offer something to the members of your association, this is a great opportunity. And we've got a lot of associations now, John, that are engaging with us to offer this plan across the country.
Yeah, again, mega tsunami, take the high ground, and we're the high ground, Carrie.
We do believe we are the high ground. Okay.
Population Science Management has those plans that we're going to fit each one of your individual clients' needs.
So again, I urge you, if you want information, go to the website, gigcare.net, or call 866-886-2030. And now I leave you with this thought from Albert Einstein. The one who follows the crowd to usually get no further than the crowd. The one who walks alone is likely to find himself in places no one has ever been. Remember, friends, it's a funny thing about life. If you refuse to accept anything but the very best, you most often get it. Thank you for listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Goodbye, America.